Thank you very much. I just want to start off by saying thank you for inviting me to participate in this webinar today. Are you able to hear me and see my screen
Yes.
okay?
Yes, both fine. Thank you.
Okay, that's great. So it's a pleasure to be here. And Sheila, I really liked hearing your story. It was very powerful. I think the voices of uh, all of our, patients, adolescents and adults with narcolepsy remain very powerful. I'm grateful to be supported by unrestricted educational grant by Wake Up Narcolepsy, and of course the Boston Marathon runners who make all of or a lot of this possible. So today I'm just going to, my focus is on children or adolescents. I'm very fortunate to work with Brian Murray, who you've heard from today as well. And I would say that I really don't know anything about young adults. 18 plus, so this one my focus is on adolescents. But thank you, Brian, for everything that you have taught me both about adolescents and young adults. So I'm going to describe the symptoms and comorbidities associated with narcolepsy in adults, but what I really wanted to do was to really understand the voice of the adolescent's experience with narcolepsy, which we've done through qualitative interviews. I'm just going to start off by describing this recent survey actually done, which looked at the perceived challenges in pediatric narcolepsy, which was just published in 2022, both by sleep physicians and also some members of Wake Up Narcolepsy organization. And this was a survey of parents, youth, and sleep physicians asking them not just about their symptoms, but the severity of the symptoms and the psychosocial impact of narcolepsy amongst this group, because I think it's really important to understand more, to really try and recognize what else we need to do to really optimize care, but also quality of life for all the children and families that we serve. So this was a survey done in children and young adults 12 to 22 years of age. It included 35 adolescents and children, as well as 116 parents. And the survey was actually developed by both the sleep physicians after literature review and in combination with a psychologist. 80% of the children with narcolepsy were type 1. So I'm hoping you can see my screen here. Can I just check that you're able to see my screen?
Yes, we can. Yes.
Okay, thank you. So this is the first slide here, which looked at the frequency of core narcolepsy symptoms as rated by both youth and parents. And I just want to say that the goal here wasn't to actually correlate individual youth and parent evaluation of the symptoms. It was just to look at group data. And, I think what you can see here, so the youth are in the black box and the white boxes are the parent report. I think what you can see here, not surprisingly, the narcolepsy symptoms that were common and very frequently reported were daytime sleepiness, disturbed nighttime sleep, depression and mood challenges, and then to a lesser extent, cataplexy. And hallucination and sleep paralysis. And there was pretty good concordance here between both the youth and the parents, with the exception of sleep paralysis, where there's a significant difference where parents thought that there was more symptoms of paralysis than the youth did, and it was similar for hallucinations. Both the youth and the parents were then asked how big a problem, or, was this a big problem, these symptoms that they were experiencing? And again, we're probably not surprised to see that excessive daytime sleepiness, disturbed nighttime sleep, and depression were all perceived as really quite big problems, both by the youth and the parents. Again, cataplexy, only 40% of that group perceived that as a really big problem. Hallucinations, again, were perceived as a bigger problem by the parents and then the youth, but overall they were considered less of a problem compared to these other symptoms that I've just described. And so then the youth, parents, and physicians were asked about the top psychosocial challenges faced by youth with narcolepsy. And I don't think the resolution of this screen is super good. So I'll just really highlight that the top 5 concerns by youth and parents, which were pretty concordant, were concentration issues, and certainly a lot of difficulty that they expressed about concentrating at school, actual schoolwork itself, getting upset easily, worrying about the future, and diet and nutrition. And interesting, there was some concordance, but not full concordance with what the physicians were worried about. They also were worried about adolescents' concentration issues and being able to complete schoolwork, especially in a timely fashion, and thinking about, how they would manage with exams. They were also concerned about adolescents getting into college and how they would manage in college, especially in an independent fashion. But MDs also expressed concern about medication, specifically not just how effective they were, but the side effects of the medications they were prescribing, as well as, the adolescents or youth obtaining driver's licenses within this group. And then, we wanted to look at the survey wanted to actually address, what are the comorbidities, either previous or current, reported by both youth and parents here. And I think what you can see here is that, the most frequently reported, again, I think we've heard some of this already today, is, anxiety, depression, visual issues, anxiety, nasal congestion and allergies, as well as, weight issues, especially being overweight and obese. Parents also said or felt that narcolepsy impeded their children's ability to have full positive social lives, friendships. And there was also concerns about the ability to excel and achieve their full potential. So I think where this survey was really good, it kind of highlighted the areas of concern, and it really highlighted, a whole host of comorbidities here. And I just want to highlight another thing here, and I think it was mentioned earlier on about, there was quite a high number here that were concerned about obstructive sleep apnea, which I must say doesn't always come up, certainly in pediatrics, although we're beginning to recognize the coexistence of OSA is much more common in narcolepsy than we had originally appreciated. So where is that survey data? What I do want to highlight today is we actually undertook some qualitative work here at the hospital for sick children, because we really wanted to hear from our adolescents. And so these were 2 studies that were published, and one was just like what it was like living with narcolepsy, and the other was a real focus on the treatment. And again, why we were interested in treatment, we know that there are treatment options, but despite treatment options, I think we all recognize that there's still a significant symptom burden for children and their families with this. So in this qualitative study, we actually asked many questions, including, why do you come to sleep clinic? How does narcolepsy affect your life in general, be that your social life, going out, or activities? And what have you had to change or give up because you have a diagnosis of narcolepsy? How does narcolepsy make you feel? What does cataplexy mean to you? What does sleepiness mean to you? What are the stresses in your life? How do you cope with stress? And then we also asked, how do you feel about coming to sleep clinic? Is there anything you want to tell your physician? Is there anything you want to give advice, or what advice would you give to another young person with narcolepsy, and how can we better support you? So I'll just show you some of these data here. So we actually interviewed 18 adolescents. These were all patients who were under the care of physicians here at the Hospital for Sick Children, 10 to 17 years of age, with a mean age of around 14 years. And 56% of this group had cataplexy. There was a lot of comorbidities, again, not surprisingly, reported in this cohort, such as anxiety and depression. With regards to the medication, 13 of these 18 participants were taking medication for narcolepsy, and 5 of these reported having taken more than one medication to help control their narcolepsy. So first of all, what we learned a bit about was how adolescents perceived narcolepsy, or perceived the symptoms of narcolepsy. Now, I think, we all know that excessive daytime sleepiness was one of those symptoms that is troublesome to everybody despite being on medication. And some just described it as waves oscillating through the day. But listed here are some of the quotes, I think, which lend a lot of insight into what these adolescents are feeling. And here's one. Normally, there's like a weight on my eye. Sometimes it's heavier, sometimes it subsides, but I know it's there. And sometimes when it's there, I lay down and I'm gone. And again, I think a lot of these quotes really helped us shape some of the questions we now ask our adolescents when we're asking about symptoms. Cataplexy was pretty much perceived as a negative symptom by all the participants that had cataplexy, although it was a range, with some saying that it was a minor inconvenience, with others saying it was a major challenge as part of their day. And, people describe cataplexy in the traditional way that we know. But here's another quote, for some reason, when I'm laughing, the muscles around my head become loose and my tongue might stick out, which I don't like. And we had recognized in children that, with cataplectic faces, that tongue protrusion was actually quite common without having any other leg or other muscle weakness. Hallucinations were described overall as scary, especially when the line between, I think, perception and reality became blurred. And I think, again, to Sheila's point, when people recognize that actually what they had been experiencing was an hallucination, and with some people saying that things in their room, even such as a towel, were transformed into a monster or something else, and they were seeing other things. So they were pretty much described as scary. So, for example, we don't just ask now, do you have hallucinations? How often we ask, do you have hallucinations? Do you find them scary? How do you deal with the hallucinations? And so forth. So it's really changed the way that we think. And then sleep paralysis was really associated with extreme fear. And we realize this is because this is the one time that the adolescents really felt there was a lack of control over their body. And it was not just fear, but also frustrating as well. And in fact, some described it as the most feared symptom of narcolepsy. And then dreams. I mean, it was interesting, right? Like, faces lit up sometimes when some of these adolescents talked about dreaming. They said it was their best part. They looked forward to falling asleep. And some of them said they could actually decide what they wanted to dream about. And they actually discussed sometimes the therapeutic role of dreams. So I think that really helped us understand the symptoms a little bit more. And again, as I mentioned, it really helped us to direct some of our questions. We also wanted to know about some of the mental health concerns in our adolescents. And the most commonly reported was mood change. And some of the mood changes were reported in these categories here. So irritability, adolescents describing getting irritable, especially when they hadn't got enough sleep. And when we asked them, how did you react to that? Like, what did you do? Or how do you manage your irritability? And some of them saying they actually avoid social interactions so that they're not irritable with family or friends. There was also some saying, adolescents describing embarrassment. And then embarrassment at when somebody's saying something and the individual just zones out and they thought, oh my gosh, why did I do that? I'm feeling shameful. And that some of them also saying that their shame was reinforced by the bullying that they had undergone at school because of their narcolepsy diagnosis. A lot of our adolescents reported frustration as well. and that's with dealing with their symptoms, because they felt that their symptoms were misunderstood. They weren't supported adequately by those around them, which made them feel like alone in their journey of narcolepsy. For example, this quote here, my dad's not be able to relate to any of it, but thinks that they do relate to it. So I think it's we think as physicians that maybe we can relate to some of these symptoms that our patients are having, but actually maybe we don't at all, especially with adolescents. I've also learned just separately that the adolescent brain is very different. Sometimes I'm not sure that we can relate to adolescents at all. And then obviously what came up as well, that the worry that the adolescents feel about finding a job or a career as well, and that how it might really affect their independence and relationship, and then driving cars as well downstream. We also learned about adolescent resiliency and coping, and it was interesting because our younger cohort, so our cohort who had been diagnosed at a younger age and had been living with narcolepsy a few years, described it actually that they had made that, it's actually part of their identity. They had learned to cope with it because they'd had the narcolepsy diagnosis for several years. And bearing in mind, some of the average age here was 14. So they've been diagnosed, at 8 or 9 or 10 years of age. And in doing so, they said that one of the other coping mechanisms was forming strong therapeutic relationships with parents, friends, and the accommodations that the schools had to make. So there was also the ones that seemed to cope better, more resilient, is the ones that had also accepted that this was narcolepsy. Maybe it wasn't as bad as some of the other things you could have in life, and that, with medications, you could still function well. But again, there was a lot of talk around how much you do really need support, and how it's really important to surround yourself with people who will continue to support you on your journey. I just want to talk a little bit about medication. I know there's been some talk about medication. So overall, when we asked about medication, do they work? What do you think? Are they effective? I think the first theme that really came through that, what medications are moderately effective, with many saying, I couldn't function. I wouldn't be able to get up in the morning and go to school. I wouldn't be able to function at school if I didn't take medications. And on the days that I don't take medication, here's a quote here described as feeling more sluggish, just lazier, and also in a bad mood. With actually quite a few participants describing how the medication actually just even putting them in a better mood, meant that it was effective for them. So I think overall medications were thought to be moderately effective. But when we explored that a little bit more, they were all very clear that actually they don't fully relieve the symptoms. And a lot of our participants talked about their ongoing residual symptoms. And in fact, to the extent that some of our adolescents, and I mentioned that we interviewed 18 and 13 of these adolescents were on medication. Some of our adolescents had discontinued medications because they felt that they weren't as effective, and they had employed other strategies, which I'll talk about in a minute, to help with their narcolepsy. And in fact, a lot of them, had also said, my doctor thinks the medications should help and will help, but they don't help at all. I don't want to take them at all. And then, here are some of the concerns expressed to us about taking the medications. So one of them, it was side effects, weight gain, changes in appetite and weight loss. Some of them felt like their mood was altered or lower or even depressed with taking the medications. And some said, I might be in a bad mood and everything, but actually the medication bothers me on top of me already being in a bad mood. But So even despite knowing the risks and the benefits, there was some negativity about just the side effects of some of these medications, even if those side effects didn't occur every day. And, around this theme, when we asked adolescents, when we asked this group, like, what could we have done? What could the physician have done? And practically all of them said, we want to be way more involved in the decision making about what medications we're taking and when and whether we want to take them as well. And then obviously there was also a group that were very worried about taking medications long term, because they said they didn't really understand, or they didn't know about the long term consequences of taking some of these medications. Our adolescents talk about behavioral strategies that they had employed. And what was clear was that, even though there was behavioral strategies that we often talk about to this group, such as taking naps for 20 to 30 minutes, something, the adolescents described that a lot of the behavioral strategies that they had found helpful were really, helpful after they have trialed, many different behavioral strategies, and that they were very clear that you have to do what works for you, and what works for one person doesn't necessarily work for the other person. But once they had found a behavioral strategy that worked for them, they were usually pretty good at employing those behavioral strategies on a regular basis as well. And here were some of the behavioral strategies that they employed. So intermittent rest, I know we talk about intermittent rest and naps and everything throughout the day, but quite a lot of our adolescents felt that, that intermittent rest, even if it's just 15 to 20 minutes, was really helpful. I have to say, though, we've heard from a lot of our adolescents, please don't tell me to take a nap during the day at school. It's so stigmatizing. That is something I will never do. And we've realized that as they get older, the adolescents will only take a nap after school. So when they're coming home from school, they haven't liked taking the naps in school. Physical stimulation, so that's regular physical activity, bike riding. I have one superb athlete who has really done a lot of physical exercise and to promote wakefulness, and has found it particularly helpful as well. So I think that physical stimulation, and this person here described, the bike rides 4 or 5 times a week. And then obviously, finding the mental stimulation, the passion, the thing that helps keep you awake, stops you from being bored, because of course they describe as soon as they get bored, that is when they're actually going to fall asleep. And then here were some of the behavioral strategies to stop them having symptoms. So that was mostly the behavioral strategies I've described to promote wakefulness. And again, I think others have described, the different strategies they adopt prior to the onset of cataplexy. And a lot of that was, changes in body position. So here somebody describes, I have cataplexy with my emotions. And when I do, I have trouble walking, but they have learned that they stiffen their legs so it doesn't happen. Another adolescent recently actually described to me how she makes sure when she's in a group of friends, and she said they laugh around and joke around a lot, she makes sure she's always holding on to a chair in those sessions, for example, after school when they're hanging around, or at lunchtime and recess and so forth. And then actually I found this one particularly sad, I think, which is attempts to stop laughing. And what this person actually described was, I stopped laughing, I stopped crying. So all of a sudden I cut it all off. To me, it was a wrong decision when I was younger, because it cut me away from people, a lot of people. And what they were actually describing was that it actually distanced them from people, right? Because it changed their personality, because they didn't want to laugh. They didn't want to have some of these emotions. So I think these strategies are employed. I think what the adolescents are trying to say is that some of them are detrimental to them on a longer term basis. And then when we asked adolescents, what could we do more? How could we, and they asked for more psychosocial support for narcolepsy, which of course I think with what I've said isn't surprising. And they said not just being seen in the sleep clinic, but they want to see a psychologist or a social worker regularly. They actually asked for more peer support groups within, from adolescents, because they learn from other adolescents as well. And then, just along the themes of that, just along the themes of trying to understand social relationships a little bit more. We didn't explore that in real detail in this adolescents, but again, this was a new study just out last year, which actually looked at, young adults with a mean age of around 28 here, around narcolepsy and social relationships. And, and these were individuals who had narcolepsy now for several years, and they describe now that social life was definitely more challenging, and over the years they had required more support from work colleagues, from friends, peers, and family members. They also described that narcolepsy had impacted their sex life. And within that, and I'm just summarizing here, that they report that over the year, there'd been little discussion with their healthcare providers on social and sexual health. And they thought that this really did need to be incorporated early on after their diagnosis and on entering adulthood. So I'm just going to conclude here, and I'm happy to take any questions. But we learned a lot from our adolescents, and I think it has really changed our approach to childhood narcolepsy. But I think what we could see is here that our adolescents require way more psychosocial support than we had appreciated, and so our adolescents here will always be seen by adolescent team member. If they need psychology, they will be referred to psychology as well as psychiatry. We provide letters and educational resources for schools. We'll go into schools, we'll do lectures and conversations in schools. We direct them to networks and peer support. And so our approach now has become a very multidisciplinary approach to care. And while we appreciate that medications remain the first line of treatment with narcolepsy, we must appreciate that also that adolescents perceive these as not totally treating their symptoms associated with side effects, and also have concerns long term about taking these medications, and that we really must make sure that we involve them in treatment decision making very early on. And then counselling about the different behavioural therapies and platforms to share their experiences about behavioural therapies remain very helpful for this group. So a lot of acknowledgements here. This work was actually started by Peter Palmer, who was my master's student, is currently at dental school and a host whole the team here at the Hospital for Sick Children in Toronto. So thank you very much, and I'm happy to take any questions.
Thank you, Dr. Narang. Excellent presentation. It's so interesting to hear, the work and the research in that part of living with narcolepsy, the social side of things, because I know that is very difficult. Hearing that adolescents want to be more involved in and have more control over their narcolepsy management, what are some ways that they can do this at home or school or with their providers?
So I actually think that we have to be, and I hope we've become like that as pediatricians, but having way more open conversations. So I know historically we're so used to speaking to parents about their child's condition, and parents are making decisions around both medications as treatment options and behavioral strategies. And I think that we have to have a shared decision-making approach, so that, if we introduce something in the clinic, for example, we have to make sure that the adolescence is part of that, but then actually letting the family go away, having a discussion at home and then coming back, rather than jumping into sometimes the treatment decisions that we make. So I think that shared decision-making model is the way that we have moved towards, and ensuring that everybody is in alignment with that medication, but also being flexible and saying, okay, you didn't like this medication or it didn't work for you. We stop it, or we try something else, or we add something else. I think really being flexible in our treatment options.
Mm-hmm. Excellent. Thank you. Another question. Are older adolescents able to access medications designated for adults when traditional medications aren't working for them? And how does that work?
So maybe I'll give you the example of Adolescent here in Canada, which isn't approved yet for under 18-year-olds. So we have no problems procuring Adolescent or sodium oxybate here in Canada. So we have, I have to just preface this by saying most of the many medications on the market, not just for sleep disorders, but I'm a respirologist as well, for respirology, were never designed for children. But we've been allowed to use them as we've been shown that they've been helpful. And I think it's the same for a lot of the sleep medications. So we are using a lot of the medications that are used in adults, we're using them in children.
Okay, good. Any other questions from the audience today? Well, we have Dr. Narang here before she leaves. You have any of the parents out there with adolescents? No. No. Well, I think that's it. So thank you very much for sharing and preparing and sharing that. That work was very interesting, the findings from your research. So I appreciate that and appreciate you taking the time today to join us, Dr. Narang. I haven't seen you in a long time.
I know. No, thank you again for the invitation. It's always a pleasure.